sex. I don't know why they prefer to use the word like the word illegal or something. Well, me can't stand. Excuse the plain talk and bad manners. We hope nobody not the correct. But right now we're talking feelings. Talking about that feeling when you're one wetting. Alright. Sent out a broadcast message last week via BlackBerry to 20 women just to see what their response would be about that feeling they get when they want to die urgently. I was amazed by the response that came back to me. Cutie say she wanna wet. Nashanda say dusty. Most of them say that funny feeling. But don't let pop gosh. She said that each you must crack. Excuse the place that man bad manners. We hope nobody not the correct. But right now we're talking feelings. Talking about that feeling when you're one wetting. Right. That feeling. Talking about that feeling when you're one wetting. Yeah. Desperate it is when they want their fuel cause when that time can eat, that feeling is so cruel cause it's like a voice in the head saying, how you want and you need and you need and you want it. I say yes, that central, internal uneasiness. The only way to fix it is to jump and still excuse the plain talk and bad manners. We hope nobody not the correct. But right now we're talking feelings. Talking about that feeling when you're one wetting. Alright. They just want to go on that ride to get to that point. Oh, excuse the place of bad manners. We hope nobody not the.
Feeling hungry, grab a snack. Caribbean food delight. Jamaican patties, slide and flaky. Caribbean food delight. Taste the difference. Caribbean food delight. Grab a patty, take a bite. Caribbean food delight. Quick and easy, grab a patty, take a bite. Caribbean food delight. Oh yeah.
I don't know why they prefer to use the word like the word illegal or something. Well, me can't stand. Excuse.
Hey, ride along, welcome to the ride. Welcome to Thursday. Yeah, Thursday on the ride. How you guys doing? As you're coming, go ahead and share up the thing. Press share. I share. Yeah, we got a conversation today, guys. We having a conversation today. Yes.
220 women.
Yes. Let me see who is inside. Let me see who locked on pretty early. Joni, how you doing? Big up yourself. Welcome to the ride, guys. As you're coming, go ahead and share the program. Let me do it as well on my side. Today, guys, it's all about you, right? This program, whenever we do it, is all about you, about women learning a lot more, or a little bit more, just some more about themselves, right? So we have Dr. K. She's been on with me for like 4 years, so like since we started Ridealong. She been on and she's been giving us so much information, and she's back with us again today. She's not always available, but when she's available, we have such a great time talking about all these things that is kind of shoo. But that's one gynecologist that doesn't hold her tongue. Oh Lord, I should never say it like that. Sorry. She don't hold her words, okay? She say it as she feel. Oh Lord, I'm gonna get blocked for this.
It's like a voice in the head.
How you guys doing? Let me start this. I start off on the wrong foot already. I apologize.
Central, internal.
Hey, Lacey J, how you doing? Everybody share. Listen, if you share it once, I want you to share it again because we have Dr. K on the ride with us today. Dr. K's on.
But right now we're talking feelings.
Yes.
Talking about that.
Let me share the program as well, guys. Let me share the program on my end. Oh Lord, I'm gonna get myself in trouble today. Yeah. Lois, your fault. Lois, it is your fault today, okay? Lydia, how you doing?
Right now we're talking.
Yes, 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 and yes, and yes. Lord, I can't believe I just said that. Anyway, let's bring in Dr. K, because we have no time to waste. Dr. K is high demand. Dr. K, how you doing, my good friend?
Hello, hello. I am glad to be here. How have you all been doing right along?
We've been doing, we've been doing good. We've been doing great, actually. How
Awesome.
you been doing? I've been following you, seeing you jumping out of airplanes and all that stuff. Like, what's up?
Yes, you got to live life. You just can't work and not live life. Always remember that. So I've been cutting off some of my the items on my bucket list. So next up is scuba diving and swimming with the sharks. So skydiving is crossed off the list. So I am ready for more adventure. And remember, you guys, you too, Junior, and
Ah,
everybody that's listening, it doesn't have to be anything like jumping out of a plane, but I want you to try to do something that you've always wanted to do. And I always tell people that on their birthday, do something you've never done before, at least once a year.
I don't know, Dr. K. I don't know about swimming with no sharks, though. I don't know about swimming with no sharks. Because my
Well,
fear is if I swim with the sharks, if swimming with shark is the eighth thing on my bucket list, I may not get to the ninth. So I'm gonna have to leave swimming with the shark for the last thing, because that's the last thing I might do.
Gotcha. But I tell you, this year has been, with the COVID-19, it's been a thinking year. It's been a growth year for me. As everyone know, I'm a family nurse practitioner. I have my doctoral degree, so I'm an author. I'm a professor as well. I work in primary care, and I launch my own private practice now.
Yeah.
Yay!
Yes. Yes.
So
Doing too much. You're not doing too much. You're doing just enough.
so I've been busy doing that. So I have my own office. People can come into the office now and they can come see me. They can get the care that they need. I was doing telehealth for a while, but now I'm open. You guys can come in if you're in, the South Florida area. And I also launched my personal lubrication, my all natural personal lubrication. So for those who need a little bit of enhancement for sex, sexual intercourse. It can be vaginal or anal. I created with my chemist a oil based and a aloe based, a water based lubrication. So you can find that on my website. It's called Sextivia. So sextivia.com.
Sexy.
www.sextivia.com. And you can put in your order and I'll mail it to you. But yeah, so I've been busy. But I'm glad to be back here. I love your audience. I love the environment, the environment. I love the questions that you guys ask. And did you all see that flyer that Junior posted
Hey,
talking?
hey, hey, hey. Hey, Dr. K. You see, Dr. K, it's something that I think we need to talk about, because it was interesting, because someone sent me that question and I say I would post it to you. In fact, I will put it out there as a teaser. And let's get right into it, Dr. K. Here is a question that the person asked me.
Okay.
The question is, vaginas comes in all different shape and sizes. What does your size of your vagina says about your personality?
Absolutely nothing. Zero, zip. It has nothing to do with your personality. You were born with, the pelvic muscle. The pelvic muscle determines the size of our vagina. It determines the strength or the elasticity of our vagina. So the pelvic muscle is what we really need to focus on as you age, as you have babies, because when you have babies, that will cause the pelvic muscle to loosen and the vagina will become a little bit more looser. But that doesn't mean that the vagina can't snap back. It can become tight again. You just have to make sure that you do your Kegel exercises. And I've spoke about that in the past, but the Kegel exercises are exercises that strengthen the pelvic muscle, just like we lift weights to strengthen our biceps, our arms, our body. We have to lift weights or to strengthen our pelvic muscle. So the Kegel exercise you can do right when you're at home. You're sitting right now. Everybody, all women, right now, start squeezing. Start squeezing your anus and your vagina. That's the Kegel exercises. I hope you're doing it. You're joining in with me right now. So squeeze the vagina. Some people say when they do that, they get a little turned on there. But that's one way that they can do. Also, another way is some women they use Kegel balls, which comes in many different forms. It comes in marble size. It can come as big as an egg. So some women, to strengthen their pelvic muscle and tighten the vagina, they insert the egg inside of them, the Kegel egg, and that will help tighten it. And they wear it all day. So this is something you put inside of the vagina and just go shopping or go to work. And yes, this really, really helps. So these are, some things that you can do to tighten it because, like I said, as we age, the pelvic muscles become lax and the vagina can become looser. So you just have to do your Kegel exercise, ladies, and that'll actually help prevent what we call like a prolapsed uterus. Because if the pelvic muscle is not tight, your insides actually start to come out. So yes, your uterus starts to come outside of the vagina. The vaginal wall prolapse, the uterine prolapse can occur. And this occurs in persons who stand a lot. So a lot of my bartenders, my waitresses, my teachers, sometimes they get what they call the prolapse of the uterus, and that just means that your insides are falling out. And when it gets really bad, unfortunately, you will have to have surgery to lift it up. But the best treatment for prevention is your Kegel exercises. And if it gets to the point where it is falling out, sometimes we insert a pessary inside to lift up the uterus. We have to put something inside of the vagina to help keep the contents in and prevent it from falling out. But surgery is really what you ultimately need when it gets really, really bad. So personality has nothing to do with it. Also, the size of the female. Some women think, and some men and women, think that the larger the woman is, the larger the vagina is. That has nothing to do with it. I have obese women and their vagina is nice and tight. Their cervix is right there when you enter. That doesn't matter. It's all about the woman and what did I say? The pelvic muscle, how strong that muscle is.
So the whole idea is to strengthen and tighten that pelvic muscle.
Yes, yes, and
But I have
yes,
a concerning question, Doc, because oftentimes women talk about that Kegel and putting that ball thing, that egg thing, whatever in there. Is
yes.
there a risk that a woman run a risk for inserting too much of a larger size or smaller size and somehow you get lost inside the body?
Well, you do want to, pick a size that, that's not too big, because if it's too big, then you're stretching the vaginal walls. And right now we want to tighten it, right? So you want to fit something that fits nice and snug in there so that it won't be falling out of you, when you insert the egg. So you do have to make sure, and they have different sizes. They have different sizes, and you will have to determine which size that you want. The female does, not you, Junior.
Listen, guys, let me just say this as a disclaimer, right? My face has a mind of its own, right? My face, I have no control over the reaction that my face makes. I see somebody say, "Junior, fix your face." I'm sorry, my face does its own thing. So
This is some interesting stuff. You
yeah,
got it.
yeah, yeah,
The things that us women go through, I tell you, right, ladies?
yeah. No, I love it. I mean, it's life. It's good stuff. There's a question here. I think you spoke about it earlier, but it has to do with treatment for prolapse uterus. What are
Yes,
some?
I just spoke about it. Yes, basically those Kegel exercises for prevention. You can use the Kegel balls, the Kegel eggs. Also do some squats that'll help, strengthen the pelvic muscle. Your planks will help. These are all exercises that you can do. And then, unfortunately, if you do have a prolapse, there's, depending on the severity of the prolapse, we may have to insert the pessary inside of the vagina to lift the contents, or ultimately surgery is what's gonna help that.
Mm.
Yes, squats does help strengthen the pelvic muscle because it works the glutes, it works the thighs, that's all in that area. It's part of the core, Michelle. So I see your question, Michelle. Yes, it can. But the main thing that you do want to do are, they call them bridges.
Uh-huh.
You lay on your back and you thrust up. You thrust your pelvic muscle up. So though that's an exercise. So Google bridges so that you'll see what type of exercise that are. But you lay on your back, you fold your legs, and you push the pelvic muscle up and down, up and down. So that helps. Bridges.
I hope the women on them taking notes. Another question that came in is that is excessive amount of sex could lead to a woman getting more loose.
Well, to answer that question, it depends on the size of the man. Because if the size is really large where it stretches the vaginal walls, yes, it can stretch the vaginal wall and her body will adjust. The vagina is amazing at adjusting. It will hurt initially, but you do adjust to that large penis. But yes, if you're having sex with a large penis daily, that vaginal wall will be more open than the ones that's having a smaller penis, having intercourse with a smaller penis, or not having sex as much as others. Yes, that's very true.
It's like a memory muscle. So, like, if a woman having sex with a guy with a bigger penis, right, and they've been doing it for a while, and then that doesn't work out, then she started to date another guy, and he has like a smaller size. Does the memory of the memory muscle of the vagina conform to the smaller penis over time, or you just stay like that on well until the woman can't really feel anything?
Over time it will adjust to that, to the smaller. Yeah, and we're talking about average size. We're not talking about like a really small penis, but we're unusually small penis. We're talking about a average size penis. And then also, we don't want to leave out the ladies who do have sex with other women, if they have, because some women have big clits, and the clits, actually the clitoris, it actually looks like a mini penis. So my same-sex couples, they like to insert the big clitoris inside of the vagina when they're having sex with their partner.
What? Hold on. So what? Doc? What?
Yes. If one day, if you want to see it, you can go on any of these porn sites and type in big clicks, BIGCLITS. It's called big clicks, and you will see women who have much larger engorged clicks than the average woman, and it's very common. It's not uncommon. It really depends on, and the clits can look as, it looks like a really small penis. That's what it looks like. Yes. Look, he's Googling it, y'all.
Keep talking, Doc. I see it. Interesting stuff.
Yes. And so, like I said, and remember, when it comes to an orgasm, our G spot is all the way up inside of the vagina. It's just a couple inches in. So it really does not, some women will have that orgasm just from if they have that same sex partner, the female and female, if they're tribbing and the big click is going inside of the vagina, they can have an orgasm that way. But yes, it's very common. And I brought that up because we were just talking about how the vaginas, they do conform. But yes, to answer that question, it will conform to the size of the penis over time. If it's just one penis, some people have different penises size, different penises daily or, weekly. So especially our single ladies out there, they may have multiple partners, and that's their choice. Just be safe with it, ladies.
So Doc, I saw the big clit thing that you were speaking of. Interesting stuff. But I'm happy to say that it don't seem like I was the only one left in the dark where that memo was concerned, because Lydia Joseph say, "What in heaven's name am I hearing thee?"
Yes, yes. It's called Big Clicks. And this is just, it's basically that's the porn term, but really the medical terminology is just an enlarged clitoris. So that's what that is. Yes.
Guys, we're talking here with Dr. K, and Dr. K doesn't hold her mouth when it comes to talking of things sex, right? And sex related, and also health related, health and wellness. People feel uncomfortable by talking about all this stuff. We don't, we're talking about it right here. But this show is about you guys, all right? So we open up the phone lines from the beginning so you guys could call in at any time, 718-701-5720. That's 718-701-5720. Doc, I want to show you a picture, right?
Mm-hmm.
And I want you to give me an explanation for this, right? Let me see. Let me see where I have it. Okay, there it is. There it is, right here. This is something. It looks like there is some sort of I don't know how to explain it, but it's something that is disintegrating the underwear. What is it in a woman's body that would cause a disintegration like this, like a bleaching of your underwear in women?
So I saw this post, someone else posted this, and so what you see there is actually a bleached underwear. However, it's bleached in an area where the vaginal secretions have just kind of stained the area. So what happens is we as women, remember, our vagina is self-cleansing. So you don't have to go inside of your vagina and clean your vagina with a rag. You don't have to douche or anything like that. So the vagina secretes the discharge. And remember, our vaginal pH, our secretions are acidic. So that's acid. So sometimes, ladies, you may see this, or even men, if you see your woman take off her underwear and her underwear is stained with vaginal secretions, that is perfectly normal. Yes, it's normal because that's how our body heals. That's just vaginal discharge coming out of our vagina. That is not abnormal. Now, it's abnormal if what, ladies? If it has an odor. It's abnormal if it's like a yellowish, greenish color. It's abnormal when it's bloody if you're not on your period. It's abnormal when you're itching. It's abnormal when it has a smell. So, that's abnormal. But our vaginal secretions shed daily, and some women have more discharge than others. Some women choose to wear a panty liner and others don't. So it really depends, but the vaginal secretions can stain our underwear because our vagina is a self-cleansing organ.
Mm-hmm. Mm-hmm. Lacey J says, well, before she said that, she told me don't forget her question. So I'm going to post a question. Now, Lacey J want to know what is vagioplasty, vaginal rejuvenation, and do you recommend that procedure?
So that's basically when the labias, that's your lips, they're kind of like shrink. So what they do is that person don't wear enough panty liners while I'm looking at Michelle's post.
Yeah.
But to go back to what was the vaginal. So yeah, it's a personal choice. Just like when men, they go and get penile implants because they want to make their penis larger. The woman,
By the way, I mean, I just want to make it very clear. But
what is,
go ahead.
what'd you say? I couldn't hear you.
No, I said the making the penis large type of thing. You know, certain men don't need that, and I was just putting that disclaimer in there. So in case you
Yes.
find that out for me, I'm just making it very clear. But go right ahead, Doc.
But some men may want, just like women get breast implants, men get penile implants to increase the size of their penis for personal satisfaction, and then sometimes they need it for their partner. But same thing with the woman. She may want bigger lips. She may want her vagina to become a little tighter. So what they do is they, depending on the surgeon or depending on what type of vaginal rejuvenation you're getting, sometimes it's a laser where they go inside and they debride the dead cells and they, make moisture, increase moisture. It can tighten the area and it can make the labias a little larger and plucker as well. So it's just a beautiful enhancement for the vagina. And yes, you can get that. It's totally up to you. It's nothing wrong with it.
You mentioned earlier about a smell, a specific smell. What does that smell? What does it smell like?
So the regular vaginal secretions, it really doesn't smell like anything. You know what a vagina smells like.
And kind of when you have
It
infection, when someone have an infection,
when
what
they
does it smell like?
Yeah, so when you have an infection, it will smell fishy. It will smell fishy. It may not be as strong as a fishy odor, but it's something that's different. And I advise everyone to know what your vaginal secretions smell like.
Hmm.
So it's okay to insert your finger and every day take your finger inside of your vagina and just smell it. And just know that, okay, it smells normal for me. But then when you smell something changing, when it's a little stronger, when it's a little fishy, and men, if you're listening, if you notice there's a change in your woman's vaginal smell, say something because she may think that that's normal for her. But say something so that she can, go see her healthcare provider because she may need an antibiotic because a fishy smell is not healthy. So usually when it's fishy or musky type of odor, that's those are signs and symptoms that it may be an infection, or the pH is off as well.
Doc, I don't know why. I don't care why you say it's hard to tell a woman that her vagina smell fishy. I don't know how to start that conversation.
Well, you just bring it up, and you want to do it when you're in a nice mood. Everything is. Michelle said, "My question is up now. I can't get an answer." Michelle, what's Michelle's question?
I'm trying to find Michelle question. That person. Okay, I'm trying to search for Michelle question. Junior. Okay, my question is that is the point is asking people to ask question and you cannot.
She's mad. You're not answering her. You're not asking her question.
It's not
Lo-
personal. I'm just going through a lot of questions.
Lois, you gotta help him out. What's Michelle's
Yeah,
question?
help me out. Well, Michelle, Michelle, you could call in as well, but I'm not avoiding your question, Michelle. You could
It's
call in or put your question one more time, Michelle. Thank you so much.
repost your question, Michelle. I wanna answer your question for you.
Yes, yes, yes. I'm gonna get that question there. Spice Baffy says, "What causes extreme back pain during menstruational period?"
So it's the contraction of the uterus, Spice. When we go through our period time, the uterus, the endometrium lining is contracting. The smooth muscles are contracting. So that causes the back pain. Also, if you have fibroids, that can cause the back pain because you can get inflammation that's going on during that time. And then also, if you're bloated, the bloating can cause the back pain. And then also, if your intestinal system is full, that can cause the back pain. If you notice that a lot of times once you have a bowel movement, that back pain lessens, right? So it can be so many different things, Spice, that causes that. But ultimately, you do want to do your, relaxation exercises. Don't be so tense. Do your tea, your hot warm compress to the area, your heating pad, and if you're not afraid of medicine, take you some good old Aleve to help relax the smooth muscles because again, it's contracting. Your endometrium lining is contracting, it's shedding blood, and that causes a lot of the pain.
Yeah, yeah. 718-701-5720. I'm searching. Michelle says she write her question three times. I did not see it. So Michelle, could you please just write your question one more time so we'll see it? Or you could always call in. Let me see. What 1 week before my period, I get severe cramps. What causes that?
So that may be a sign of fibroids. Michelle, when was the last time you had a transvaginal ultrasound? Because what happens is a week before your period, sometimes you have cramping, but I do notice that a lot with women who have fibroids. But that can be a cause. Also, remember, we're going through hormonal changes. Our PMS, premenstrual syndrome, happens right before our period. So some women get breast tenderness, they get a little bit of cramping, they get irritable, they get breast lumps, headaches, migraines, all of that PMS. You know what you get right before your period. But because of the hormonal changes, that can cause, a lot of the premenstrual syndrome. But specifically, the cramping that happens in some women because of the changes in the pH. It could be sometimes a sign of infection. And then, like I said, sometimes if women, more times than others, when women have fibroids, I do hear that a lot, that they have cramping prior to their period. So I recommend, taking like an Aleve, like before your period, just to help decrease the smooth muscles. You can do, if you're into natural medicine, find your anti-inflammatory. I heard pineapple is a good anti-inflammatory. I heard ginger. I heard turmeric is natural anti-inflammatory. So ginger tea, turmeric tea, all of those things may help with that, Michelle.
Right. And what helps with better tasting vaginas to make
There you go. That pineapple. You remember that, huh?
tell them, because they said that the people don't believe that. So you got to tell the doctor.
No, that's true. That actually helps. It helps more with the semen though. So, the semen depends on, like, if for my ladies who like to swallow their men's, cum, if they drink lots of water, if they, drink a lot of sweet stuff, that'll sweeten the semen. And then
Mhm.
same thing with the vaginal secretions. It sweetens it up. Get you some fruit, high sugar fruits, that helps as well.
That's right. That's right. We got a call on the line. Call your line. Where you calling us from?
Hey, Junior.
Hey,
Good evening. This is Spice here.
Spice. Go right ahead, Spice. Ask your question.
Okay, I asked one, but I have a very important question.
We want to hear your important
Last
question.
night, one of my friend and I, we had a discussion on douching.
Okay.
And he telling me, oh, a woman must douche, especially when the period is done. So I said, why? He said, because they have a lot of blood that is remaining in there and they need to go in there and douche to take all that blood because it smells after your period. So my question, is that true? Do you have to douche? And number three question, what cause after a period, sometimes after a woman period, some people say they have a smell. Is that normal after your period to have a smell?
So to answer the first questions, you should not douche. And the reason why is because that goes back to what I said, Spice. The vagina is self-cleansing. So you have to let the vagina cleanse itself. For those who do douche, remember what douching does is it gets rid of the bad bacteria, yes, but it also gets rid of the good bacteria. And we don't want to rinse out any of our safety mechanisms that's in our vagina. So douching can change the vaginal pH and cause us to get more yeast infections. It can also cause us to get more bacteria vaginosis, bacterial infection. So no, I do not recommend douching. Now, what I do recommend is before you engage in sexual activity, let your period totally go off, because what happens is, some women say, oh, my period is off, but let's say you bled for like 3 days, but then you still have a little spotting going on. That means your period isn't off. You have to let like the whole 7 days or the whole 5 days get rid of all of the like you said, the excess bloody drainage that's left in there. Because when you have the spotting that continues, then that's because it's not totally done. So that answers that question. And then what was the second question again, Spice?
No, I think we lost Spice.
Oh, she asked, I know what it was. She asked about the odor after the period.
Yes.
So if the period once the period totally goes off, you will notice that your vagina goes back to its normal vaginal pH. So when you actually have a smell even after your period goes off, then that means that the hormones that can occur, the hormonal imbalance due to your period, cause your pH to go off. So it should not be a continued smell, Spice, just to let you know. That smell after your period's gone off, yeah, but after that, you shouldn't have a smell going on after that.
Okay, all right. We got another caller on the line. Caller, go right ahead. Where are you calling us from? Hello?
Hello?
Hi, go right ahead with your question.
Yes, my question is, I'm calling from Pennsylvania. My question is, now I have a daughter who just started her period, like last month. Is it normal for her to like miss the second period?
Say it again. I'm sorry, I couldn't hear.
Yeah, say it again.
I have a daughter. She just started her period. She just turned 13 and had her period for the first time. Let's say for May. June, it doesn't come. Is that normal?
Oh, yes. So during the teenage years, unfortunately, they have irregular periods. So that's not uncommon. So she may get a period 1 month, and then it may not come on the next month, and then it may come on the next month. So irregular periods is not uncommon when you first start your period. And then it gets back on track. It usually gets on track usually after a year of having your period. So it'll get back on track. But after a year, if it does continue to stay off track, then she may have what they call PCOS, which is polycystic ovarian syndrome. That can cause irregular periods depending on of her weight. She may, I don't know if she's a heavy child or
very tiny.
Oh, okay. That's why she started late. That's yeah. I figured that because she started at age 13. Because normally you would start your period. Each person is different, of course, but you would start it at age 11 or 12. Usually 6th grade or 5th grade, going into 6th grade. But yes, it's to answer your question. It's not uncommon, Mom. So don't worry. She'll get on track.
Next question is: you mentioned about the exercises for the vaginal area. How much of an exercise, say, per day? How much time do you have to squeeze? So
don't be doing it all day. Don't be doing it all day. Don't get all. Doctor, you take the question. I forget. I'm not the gynecologist.
Yes. So you do want to do it 3 times a day. You do want to do it 3 times a day, and you just do it like 20 times. You just squeeze 20 times. Squeeze 20 times for breakfast, 20 times for lunch, and 20 times for dinner. Now that's the Kegel exercise. And then if you're using the balls, you can use the balls like twice a week or 3 times a week. And then if you're doing your bridges, the exercises where you're actually working out, you can do that like 3 times a week as well. So nothing you have to indulge in, but it's something that, it's quick and easy. So you can just do it.
Okay, thanks a lot.
No problem, Doc. No problem. Thank you for calling.
Okay, well,
thank you for calling. Here we got a question. Lois JJ. She said, Dr. K, let's talk about drinking. Only Lois JJ could ask a question. It's healthy to drink sperm.
Well, it's not unhealthy to drink it. Now, some women, depending on the taste of it, it comes right back up. So sometimes some men's sperm is very it's very acidic. So it tastes really bitter and sour. And some women, that doesn't take hold to their stomach. They get nauseous afterwards. So men, you have to be aware of what you're eating. You have to make sure you eat healthy, drink lots of water and that good old pineapple juice, right? But you have to make sure that, it's, but it's not unhealthy to answer the question. But it can taste terrible depending on the male.
Really?
So men, it's okay. Taste your sperm and make sure you do the sperm check.
Don't say that, Doc.
Just like us women, we have to smell our discharge. Some women taste their discharge, their vaginal secretions. Some women, they touch themselves. So, men, you can't shy away. You want your woman to do it, right? But you can't taste yourself.
No. It's not going to happen. Woohoo! No, Doc, that's not going to happen. Somebody says 0157200.
Marsha says some of them drink too much rum, hence the taste. That's right, Marsha. That alcohol will really make it taste bitter.
So it just goes to your system. So if you eat the pineapple or whatever, it just goes straight into your system and just goes straight to the sperm.
Yes. Well, it kind of happens like that. Yeah, you got it.
Right. Oh gosh, let me put up the number. Guys, it's your show, not mine. So you guys call in 718-701-5720. I'm just facilitating this one. Doc, I also saw you have something, right? Which is very interesting. You said walnut consumption improves sexual health. Eating walnut increase sperm vitality, mortality, and morphology.
Yes, that's the shape of it. So basically, for my patients who have a hard time getting pregnant, they have an infertility issues. So what happens is it's not always the woman. So after the woman have her ultrasound, after the woman has, we see that her tubes are open. She can have kids. Her egg production is good. We also do what they call a semen analysis. And the semen analysis actually checks for the male fertility, and the morphology evaluates the size and the shape of the sperm, make sure it's not missing any parts. It also checks the how fast it's going. All right, because if it's going slow, then it may not reach the fallopian tubes in time. It and then it depends on the amount as well. If he doesn't have that much, then that can decrease the chances of their partner getting pregnant. So
Mm-hmm.
yes, those are just some natural things that can have proven over the years that may help. Not all the time, but that may help. But walnut is one of them. Yeah.
Excessive masturbation and excessive, like having a lot of sex, lessen your sperm count.
Yes, it does.
Really?
That's a good point. It really does. In men, it lessens the Marsha says lazy sperm. It lessens the sperm count. So, and then also men who are truck drivers, because they sit so much, that, and remember that the sperm cells develop in the scrotum sac. Chemo says his is speed of light. His
Yeah,
sperm is the
I
speed of
keep
light.
you a damn liar. Keep it as hell. Anyway, I don't
but
know.
but low testosterone can cause low sperm count as well. So those are some things that can definitely affect fertility.
Right, right. Guys, 717-015-720 is my number. You could call in anytime. Let me see what Bobby's had to say. What does texture or density, what does the texture or density of semen means?
Well, I like that question. That's a good question.
Mr. Chuck?
So, it really just it depends. If this is the texture and the density of the semen that you've always had, then that's normal for you. But if it's some changes going on, then there may be some cysts in the tract, the semen tract. And what he means by that, or she means by that is, or he, I'm sorry,
Yeah.
what he means by that is some men have really thick sperm, like the seminal fluid that comes out, and
Mm-hmm.
some men, they have really watery, seminal fluid that comes out. So again, that's just depending on sometimes the intensity of the orgasm that can cause that can affect that. But it's just a man's characteristics. That's just their sperm. That's their sperm characteristics, their
Yeah.
seminal fluid characteristics.
Spice Baffy has another question. Is it true that great sex make a woman vagina tight?
That's a good point, Spice.
Mm.
So what happens is when the woman is having sexual intercourse and she is enjoying it, the vaginal actually contracts. All right. So just like when she has an orgasm, the vagina contracts. And so that's the same thing. That's what she's talking about. When she's having sex, it does. It makes the vagina tighter. It's just like you're getting tense. So
Mm-hmm.
the vagina gets tense too. So when you feel that vagina getting tighter, that means men, when you feel it getting tighter, she's about to have an orgasm or she's really enjoying it, because the body, her vagina is responding to the amazing feeling that she's feeling.
And it's a good thing. It's a good thing. It's a great thing. Get it tight. Doc, I don't know nothing about.
Oh, she's okay. So Barbie said he had a girlfriend who used to test the seminal. That's why he asked the question. He now so see that's different now. So this is a different question. So she used to test his ex-girlfriend used to test the seminal fluid depending on to see if he was cheating or not. So what she was seeing is it wasn't about the texture, it was the amount.
What?
So, yes. So remember, if you're having sex often, usually, and it doesn't happen to every male, but just think about yourself, Junior, or the men who are listening. If you're having sex every day, you're not going to have the same amount of sperm that comes out when you have an orgasm every day. You might have a little bit of sperm that comes out, right? So that's what they mean. So they're saying that so his girlfriend was actually seeing if a lot of sperm came out, that means he hadn't had sex in a long time. Or he wasn't masturbating in a long Julia say, I don't know if that's true.
That's too deep. Right? That's too much investigative things. But what you guys, how much sperm comes out and all that stuff? Too much.
Yes. But sometimes, again, ladies, you don't want to start checking the sperm because sometimes it can depend on the contraction of the orgasm. Because sometimes if the man has an intense orgasm, he's going to have a lot more sperm that comes out. And then, I mean, hey, if you guys are having sex often, yes, it's not going to be a lot of sperm that comes out every day. The sperm has to build back up.
Yeah. So, Doc, how many times per week should a man engage in sexual activities, including if they choose to masturbate from time to time? Give me a count. That's good.
So you know it depends on the man. You know, you can have sex every day. You know, men can have sex every day if they want. It's just that excessive masturbation becomes a problem when it interferes with their partner getting pregnant. And what I mean by that is sometimes if you're constantly, using your hand to masturbate, right? And you know how the friction is. But then when you're having sex with your partner and you can't ejaculate via vaginal sex because you're constantly using your hand, the friction, the tightness of your hand is what you're used to. But her vagina can't compete with your hand, right? Because her vagina might not be as tight as your grip. So some men, because they're constantly masturbating, they can't ejaculate via vaginal sex. And that becomes an issue for people, especially when they are trying to conceive. They're trying to get pregnant. They can't because he can't come when they have sex.
Sad.
Yeah, so that's when it becomes an issue when that's when it becomes excessive, when it's really interfering with your day-to-day practices. That's no fun if you're having sex vaginally and you can't ejaculate because you're always masturbating.
They get addicted to their hands. They get addicted to their own damn self. This is an interesting question that I want to think. Chemo kind of alert to it. Men that comes quick ejaculation. What assistance could you give to men who ejaculates too fast?
Oh, that's a good question. So, there is a condition called premature ejaculation. That's what it's called. It's called premature ejaculation. And what that is when you're having sex and you basically come really quick. Okay. So usually less than like 3 minutes. Soon as even some men, they ejaculate just on soft, like they get really turned on, so intense, and then they explode before they even go inside of the vagina, right? Or sometimes when there's just sitting there near the vagina and then he just comes. So a lot of men actually suffer from this. It's called premature ejaculation. So some of the things that they can do is they can sometimes use the numbing topical spray, like to numb the penis so that he can last a little bit longer. Also, they have numbing gels, sprays. They also have um, medications that help with that. That will help extend the length of the sex. But and then ultimately he has to because it's all about sometimes anxiety too. They get
Hmm.
excited, and that makes them come quick. So it's really about relaxing the nerves, and not being so anxious.
Right.
So,
Calm yourself. Calm yourself.
mhm,
You
mhm.
that happens when you are not very experienced, probably as a younger man, not really know the whole ins and outs about the thing. I remember as a young going to the channel as a young guy, that used to happen. But now as you get older, you get more experience, you know what I mean?
No, it happens to older men as well.
Like,
It's a co- it's a
it-
common condition, Junior.
really?
You're lucky not to have it, but it's very common because the mental is very strong. The mental affects our physical. So a lot of men who suffer, grown men, not talking about teenagers, I'm talking about men 30s and up. They experience premature ejaculation because of the anxiety. The
Mm.
anxiety really affects their performance. It's called performance anxiety. You start thinking about, I hope I please her. I hope I last. I hope it gets
Oh.
hard. I hope it gets hard. Things like this. You start thinking about those things, and it really, really can affect. It really does affect many men. And then also, yeah, it does. So, like I said, sometimes, just using those topical sprays, sometimes using a condom. If you have a steady partner that you don't use a condom with, using
Mhm.
a condom can kind of delay the ejaculation. And then ultimately, medication can help as well. That's what I
Mm.
prescribe to my patients.
Okay, guys. 718-701-5723. We have like about 10 minutes left. So this is your show, by the way. This is your show. I saw someone post something there a little bit earlier, and they're talking about why are we using the platform to talk about some miniature things or such small things. I just want to say this, that this platform is a platform for everything. We talk about politics, we talk about life, we talk about relationship, and yes, we talk about stuff that affect the human body, like sex, right? But this is just a natural being of human beings. Sex, a vagina, penis is just like your hands, your ears, your head, just a body part. So why should we not talk about it? So if you
Yes, I totally, Junior, you're right. I totally agree. And that's the taboo thing in our culture, in the Black culture. Usually, that's something that, we raise not to talk about. I know in the African American culture, the Caribbean culture,
absolutely
I know it was like it's major not to talk about that.
true,
Could you talk to your mom and dad about sex growing up? No, they would slap you.
yes,
Same thing in the Caribbean culture, the African American culture. It's so taboo. We don't talk about it. We have to, feel comfortable talking about it. We have to, talk about how safe it can be, how healthy it is. It's healthy for us, as long as we do it responsibly. And we have to be knowledgeable on this, and we have to educate our kids as well. That's why I created the book, Let's Talk Sex and STDs, the student edition, because it tells these teens, how to be responsible during sex, what to talk to their parents about, what are the different STDs, because a lot of grown people don't know what trichomonas is, which is a STD. A lot of grown people don't know what crabs is. A lot of grown people don't know that they can get genital warts from skin to skin contact. So I created that book so that we can start educating our teenagers, our preteens, our families, start educating ourselves versus just Googling everything, which, you can find a lot of different misinformation out there. But Junior, this is a great platform that you're using to talk about all aspects. You talk about mental health on here, you talk about physical health, you talk about sexual health, and this is great that you are bringing this to the forefront. Your fans have to get used to, what we bring to this society, what you're bringing to the world. And sexual health is part of humanality. That's part of life, and it's
absolutely,
something that we do every day. So hats
absolutely.
off to you.
Absolutely, absolutely. So we'll talk about God, we'll talk about everything else, but sex is something that we need to talk about as well.
Because it's something that you do. That's how we reproduce as a race, or if you have same-sex couples, that's how you engage with each other. You share your sexual, your emotions with each other. So, sex really helps with stress. It helps us, relax. It helps decrease anxiety. It helps promote a happy mood. It gives us energy. It helps us exercise if you're active during sex, not just laying on your back.
Yeah.
Ladies, you got to get up and ride the penis. You got to start doing some squats on the penis.
Yeah.
Men, y'all do a lot of work during sex, so
you know. Okay, Doc, you have a master class. I don't know if you had it already or you have it coming up, but it's very interesting. Very interesting. Orgasm masterclass. Is this coming? Oh, this is September. Is this coming or it passed already?
No, it passed already, but the recording is still on my website.
Yes.
So you can go to drkatinakennedy.com, DRKATINA Kennedy.com, and you'll see masterclass. And it's it talks about the different types of orgasms that we as women can have. You have your anal orgasm, your cervical orgasm, your G spot, your A spot, your U spot. There's so many different types of orgasms. So my class,
blended.
Yep. Mental orgasm, your nipple orgasm.
Doc, I never knew about the G, A, and U spot.
Yes, those are different spots within the vagina that when the man hits, that can elicit an orgasm. So yes, it's definitely present. So in my presentation, my orgasmic masterclass, it's very cheap. Go online, order it. It'll come once you order it. It'll come directly to your email, and it talks about ways to actually get it actually, I'm just looking at your comments here. It actually can't wait to, it gives you ways to help those different orgasms, to achieve those different orgasms. So it's a really good class. It was fun. I had hundreds of female and men, because the men want to know how to, make their partner, have an orgasm too. So
Doc, it's a good and interesting topic, because as men, a lot of men don't know how to please their woman. Like after a man come, he feel like that's it, we're done. But the woman is left unpleased, and there are a lot of women that just never had an orgasm. Funny enough, they're in relationship, they're married, and they just don't have an orgasm.
Yes.
Concerning to a lot of women.
Yes, definitely.
Before you answer that, let's just take this call that just came in. Caller, you live, where are you calling us from?
Hi, good night, Junior. I'm calling from the UK.
Go ahead, the UK.
Yes. I just want to ask the doctor a question. Now, I'm 28, and since a teenager, my period irregular. And when I was 18, did so much tests and stuff in Grenada, and I was told that I have PCOS, which is polycystic ovary syndrome. When I came to the UK, I did so much internal scans, ultrasounds, blood tests, everything. My hormones are normal. My uterus is in the right position, right shape, and yet for all, my period is still irregular, and it's like they can't tell me what is it, because they just find like it's strange. Because my blood test, everything, my pH balance, everything is fine, but yet for all, I do know that my family suffer with this type of condition. My sister, my cousins, my aunts, some haven't seen period in 6 months and they just come, and it's making me a little stressed out,
right?
Because I can't find a solution. So if you have any tips on what should I do. Sometimes I think maybe I should lose weight, maybe I should eat more healthy, like all this stuff, because there's nothing health-wise, there's nothing wrong with me.
Okay.
But my period is irregular.
Okay, so you'll have the doctor answer it. You have to go back on the live to hear her response, okay?
Thank you.
All right,
Thank
no problem. Yeah, give her a quick second before she get back on the live there. I hear that a lot, doctor.
Yes.
Talk to us about that.
Yes, so polycystic ovarian syndrome, that's something that I talked about a little bit earlier on the show, but that affects a lot of women. So what I want you to do is I want you to and I should have asked this question while you were on the phone, but do you have a lot of cysts on the ovaries? Do you have follicular cysts? Because you do have PCOS, that causes a lot of cystic, your ovaries are cystic. The cysts on the ovaries, the multiple cysts on the ovaries will cause the irregular periods. Now, if you don't have any cysts on your ovaries, then ultimately you will just have to change. And I hate to say this, but it happens. In my patients who have PCOS, that actually changed to a plant-based diet once they drop 50 pounds, once they change their diet, eat healthier, water, exercise, their periods become regular. I mean, it's that. I hate to say that. I know you've been hearing that, but that ultimately is the treatment for PCOS because it is a genetic condition. As you know, like you say, your sister, your mom, they had it. But yes, weight loss is going to help. Change into a plant-based diet, eating healthy, exercise, and but just find out if you have some cysts on your ovaries, because if you have the cysts on your ovaries, that will definitely cause irregular periods. Yes.
Yeah, that's her saying that she was told that she had that cyst, but it was told that I shouldn't worry. She shouldn't worry about it.
Well, that's is that the one who called in?
The same person that called, I believe.
Oh, okay. So Nabothian cysts are different. I'm talking about Nabothian cysts are the one that's on the cervix. Yes, that's pretty benign. That isn't anything to worry about. But I want you to find out from your provider if you actually have cysts on your ovaries. That's what I want you to find out, because that will cause irregular periods if you have the cysts on the ovaries. Because if your hormones, everything is normal, then it's probably the cyst that's on your ovaries that can cause that.
Okay. Bobby's asked a question there. We'll take two more questions and then we're going to end because we're a little bit over time already. I want to say it in the most platform friendly way, right? So bear with me here. He wants to know what is the best way to pleasure a woman when having oral sex. What is the best way to do it? Like some men do it in a wrong way and they don't quite understand. So just explain to the audience the procedure, the best procedure that's more pleasurable for a woman.
So you always want to communicate with your partner because each woman is different. So you do want to communicate with your partner and see what makes her feel or him feel good when you're having oral sex. So for example, some women, they only like for the tongue to enter into the vagina when you're having oral sex. Some women hate that, but then majority of the women that I speak to, they love when the men caress the clitoris. It's all about the clitoris. Take your time, slowly. Put your tongue against the clitoris and massage it with your tongue. Even give it a little suck here and there. It's all about the softness of it. Stop being so rough, men. Sometimes you're too rough. But again, some women like it rough. Some women may like their clitoris bitten. But you gotta ask your partner. Just say, you like this, baby? And then men, you have to respond to your partner. Say, yes, that feels good. Do it a little harder or make it a little wetter. Like if, for the men, they sometimes like it wetter when you're having oral sex. Sometimes they like for you to put it to the back of their throat when you're having oral sex, right, men? That's what you like. But then So you have to communicate that with your partner. But to answer your question, you really have to ask your partner. But I know majority of the woman likes it slowly caress the clitoris, nice and slow.
All right. Doc, that's where we end it right there, guys. That's where we end it right there. I also must say that this conversation is for educational use only. All right, guys. I have to say that because Facebook like to ban me and block me because I don't know if they think that we're erratic or something. I don't know. I give you the chance to give last statement, last comment on the topic. Tell us about everything, where they could contact you, where they could get your products, how they could link with you. Give us some information, Doc.
All right. Follow me on Instagram, you guys. It's Dr. DrKatina _DRK. So on Instagram, that's where I post a lot of health and fitness tips. Also on Facebook. But then if you want to view a lot of my past videos on some of the topics that we talked about today, guess what? Go to my YouTube. All right. Go to my YouTube. YouTube is Dr. Katina, DrKatina on YouTube. So very, very educational videos. So follow me on IG and YouTube. And I'm on Facebook, Dr. Katina Kennedy as well.
Yes.
And then my website, if you want to order your personal lubrication, go to my website, www.sextivia.com. It's amazing lubrication. It's not to say that you don't get wet during sex. This just helps enhance because as we know, when you're having sex, if you're having sex for a prolonged period of time, sometimes the women dry out, right? And you're not supposed to use spit. I've talked about that before. No spit. So you can use my vaginal lubrication. It's natural. Women, it doesn't cause that vaginal irritation that some of the other lubricants cause. And it's aloe based, coconut based, and it's very good for you. So I hope to see you guys on my platform as well. And I'll see you next time.
Absolutely. Thank you so much, Doc. It's always a pleasure. And we will connect again sometime soon, hopefully.
I don't know why you want like the word illegal or something. Well, me can't stand.
Yeah, Doc, listen. I want you guys to check out Dr. Katina Kennedy. She is the best. Trust me, what I'm telling you. She has all the information. I'm gonna paste the information for her on my on Ridealong page, so you guys could link her up. Okay. You guys could link up the doctor and get your lubrication. Remember, don't spit. Don't spit. Don't use spit. Use the lubrication. Very informative, yeah. Let me tell you, whenever the doctor come on, she put it down. She put it down raw. She don't sugarcoat nothing. That's what I like about Dr. K. If you want to see Dr. K back on the ride again, put a thumbs up.
She said that
yeah?
You must scratch that.
Yeah? That's an IG right here. That's a Dr. IG right here. Dr. Katina _DRK. And also for the products, Sextivia, SEXTIVIA.com. You guys should check that out. Yes.
Yeah. Desperate it is when they want they feel will come. When that time on
Hey, Lord have mercy. Listen, guys, I was I know we was entertaining some conversation about where someone was saying that we don't need to discuss this type of things on the platform, and I reiterate on what I said earlier, right? This platform, is for everyone. Sometimes we might talk about things that you may not like. That's fine. It's quite understood. We publish a poster like a few hours in advance, so some content or some topic may not fit your fancy, right? And we understand that, but that doesn't mean that we shouldn't talk about it. If you don't want to listen to it, that doesn't mean that everybody else won't find educational value out of it. So it might not tickle your fancy, and there might be another program another day that might tickle your fancy. So we have to cater for everybody. So I know you might be biblical, you might be about very spiritual and very hush about topics involved in sex, but there should be nothing, that should be so hush-hush about talking about sex. It's natural human beings. That's what we do. That's how we all got here. Alright? Wendy, Brave Boy, thank you so much. Carla, nice to see you. Claudine. Everybody say they want to see Doctor again, boy. Wow. Yeah, everybody. She'll be back. Doug, big up yourself. Yes. She'll be back.
How you want and you need and you need and you want it. I say yes. That central, internal uneasiness. The only way to fix it is to jump and still exclude the plain talk and bad manners.
Guys, tomorrow, hey, Doug in St. Vincent and the Grenadines, in New York, representing for St. Vincent and the Grenadines. Thank you so much, Doug. Guys, also don't forget, on Friday we have a program called Right Trivia, right? It's a game show. We want you guys to come in and play with us. Tomorrow we're going to be a little late again. I apologize. We're going to be a little late tomorrow. Tell you guys up front, we're going to be late tomorrow, okay? But check this, for the whole week we've been on time, and week following that we'll be on time. But tomorrow I have an engagement that's kind of overlap my 6 o'clock schedule, so we're going to be a little bit late. But keep it tuned for a notification. When we come on, you get a notification. If you didn't like the page yet, I want you to go and click that like button. And also, if you did not yet become a subscriber or supporter of Ridealong, go ahead and click that button right at the bottom and become a supporter of the program. You get a badge and you're an official supporter. All right. So thank you for watching. Thank you for being a part of our program today, guys. We'll catch you again tomorrow. Peace out. Good night.
I don't know why they afraid to use the word like the word illegal or something. Well, me can't stand. Excuse the plain talk and bad manners. We hope nobody not the correct.
Again, we'd like to thank and congratulate the winners of the semi-finalists, of the $1,000 business grant from Ridealong Live. Starting next week, we're going to have the semi-final round, and you get an opportunity to pick a business that will win the $1,000 grant. Compliments you. This is all because of you guys. This is all because of the riders. We could do and donate and support our community. So thanks for supporting. And congratulations to our $1,000 ride-based grand semi-finalists.
She said that each you must scratch excuse the place that man bad manners.
Yeah, Chemo, you just got to keep posting Facebook. I've been doing some crazy stuff lately, so hopefully you get your badge back, okay?
That feeling when girls want to wet it. That feeling, talking about that feeling when girls want to wet it. Yeah. Desperate it is.
If you need a streaming company, guys, if you're getting married, or if you have a service, an event you want live stream, you gotta contact us, Ridealong Family, 718-701-5720. That's 718-701-5720. Professional live streaming and more.
Fix it is to jump and still exclude the place that man bad manners. We hope nobody not the correct. But right now we're talking feelings. Talking about.
Hey, do you have a business and you want to advertise? Yeah. Advertise your business on Ridealong Live. Call us for more information.
On that right. To get to that point. Right now we're talking about sex. I don't know why they're afraid to use the word like the word illegal or something. Well, me can't stand. Excuse the place that man bad manners. We hope nobody not the correct. But right now we're talking feelings. Talking about that feeling when girls want to wet it.
Feeling hungry, grab a snack. Caribbean food delight. Jamaican patties, slide and flaky. Caribbean food delight. Taste the difference. Caribbean food delight. Grab a patty, take a bite. Caribbean food delight.
David Williams Funeral Service serve you with dignity and compassion as you mourn. Every day, we embark on the journey of life, and one day, the journey will end. It's on that day that you can entrust the celebration of life of your loved ones to David Williams Funeral Service. Call 718-291-3823.
My name is Hollis Map, aka Mr. Killer. Why should I drink any other rum than Clark's Court rum? When Clark's Court is the rum that supports my community, my culture, my country. A long time ago, my ancestors used to work in the cane fields. Today, we own the rum, Clark's Court rum, Grenada's #1 rum. But my people, if you drink, don't drive. When you drink, drink responsibly. And if you're under 18, don't drink at all. Clark's Court rum, Grenada's #1 rum.
Welcome to TD Bank, where you'll find the personalized attention you deserve and the legendary experience you expect. Let's do business. If you are a medical or dental practitioner, contact me to hear about our tailored lending solutions for residential mortgages, equipment purchases, practice-related commercial mortgages and refinance. Visit me at 500 Baychester Avenue to hear more about our full range of personal and small business banking solutions. See you soon.